Hey guys, I'm back. This is Dr. Doug here at Granite Coast Orthodontics, and I want to walk you through my thoughts on oral hygiene if a patient is struggling, okay? So I have a few products here we can talk about, and I also have some ideas we can talk about. Most important thing is 4 minutes of brushing, okay? They actually did a study on mouthwash at one time, and all they said was rinse your mouth for a minute and spit and we'll get started. And they timed people and they figured out that the average person thinks that 17 seconds is a minute when something strong and minty is in their mouth. And so a timer is great. All of these electric toothbrushes that we now carry in the office, we've gone through carrying Oral-B, Sonic Airs, now we're promoting Burst. They're all good, they're all effective. I am currently using both an Oral-B and a Burst at home. And I like the Burst because they're automatically, once you subscribe with them, you have a lifetime warranty, which to my knowledge, nobody else is offering. And they will automatically send you a new head when you sign up for their program. It costs a few dollars, but it arrives on your doorstep and then you go, oh, time to change it, click. So I think that's really slick. The electric toothbrush in my mind is the most important thing. So 4 minutes with an electric toothbrush should get them 95% of the way there, okay? A couple other things that can help kids, because let's face it, as we're growing up, it's a learning process. This is plaque identifying toothpaste. So you remember getting those little red tablets when you were a kid, you pop them in your mouth, move them around, spit it out, and the next thing you know, you smiled, and everything in your mouth was glowing red because all the plaque and bacteria was highlighted. Took 30 years, but somebody figured out, just stick it in a toothpaste. And so this is the only one I know of at this point. They probably have a patent. But we carry this at the office, and like anything new or different or special, it's a little bit more expensive than normal toothpaste, but it's gonna stain their plaque blue, and at least when they're done, they can look in the mirror and find the spots that they missed. Okay, so I think that's a nice thing too, and it's something that we carry and we sell in the office. Everybody, just like they get the free electric toothbrush or water pick when they start, you get to choose. Everybody also gets a free tube of ClinPro 5000. This is prescription only, so I have heard there's a couple pharmacies carrying it now, but that's brand new. In the past, you could really only get it through ordering through dental suppliers. But this comes in a few flavors too, by the way, a couple of mint varieties and a bubble gum. If you have a dairy allergy, and I don't mean lactose intolerance, but a true milk protein allergy, you want to stay away from this, and I can get you a different version. But this is a fabulous product. It is a prescription strength toothpaste. It remineralizes the enamel crystals after you've had something acidic, and hardens your teeth in a way that regular toothpaste doesn't. And it also has a high dose fluoride, which makes your enamel much harder and stronger as well. So this is really important. This is your nighttime toothpaste, okay? If you're using a regular over-the-counter one, that's your morning toothpaste, or the plaque IDing one, okay? We also have a water pick. So if someone's having trouble and maybe they got some decay between their teeth, which fortunately is not as common as it used to be, but it's certainly one of the bigger things out there in dentistry. This is a water flosser, so it's just faster than flossing. Is it more effective? I don't necessarily think so, but if it's easy and you're struggling to get your kids to do proper oral hygiene, putting something that's easier and maybe a little more fun in their hands, it's probably a great idea. But use it in the shower, you're gonna make a mess, okay? And then a couple other ideas, all right? I've got boys at home, and every once in a while when I want them to get upstairs and start brushing their teeth sooner, I go, okay, whoever's first person upstairs and start brushing their teeth gets to pick the song. And so develop a little playlist on your phone, and if you've got a teenager, they can develop the playlist. But most songs are gonna run 3, 4, 5 minutes, something like that. And pick ones that are longer, and it's the toothbrushing list. So you start brushing your teeth, you hit a song, and you go till it stops. This toothbrush will stop exactly at 2 minutes, and then you gotta turn it back on and you go to the bottom arch, okay? So I also like that idea. Seeing your dentist every 3 months is also a great idea, okay? They can get everything cleaned up and taken care of. And then the last idea that I have is actually brushing your kids' teeth twice a week, okay? Doing it every day, I think, is going to be nearly impossible. But you can blame me for this, and I'm happy to introduce the idea, but is to literally take the toothbrush, have your kids lay on their back. You can kneel right behind them. Essentially, your knees end up about where their ears are, and you have a beautiful view, just like you're in one of my dental chairs, okay? And you can see their teeth really well, and have an opportunity to really square things up. Maybe that's the night where you take the proxy brush and use that too. Do I want you to use that every day, once or more, including the proxy brush and floss? Absolutely, that's ideal. But if we're struggling to even just brush our teeth twice a day, then we need to think differently. And how do we get them through this process with the least amount of trouble? The least amount of overgrowth of gums, the least amount of tooth decay, the least amount of tooth scars. There's nothing worse than seeing a beautiful person finish their orthodontics and they have beautiful teeth and they have scars all over them. So luckily that's more rare than it used to be, but it's still a thing out there. And I actually find that post-COVID, for some reason, oral hygiene has become harder than it used to be. So I'm here to help. I wrote my thesis on this stuff. So I have a passion for it. My team is good at it. Ask questions, and we're here to help. We're here to inspire. Anything we can do. I'm also happy to send letters to your dentist to encourage getting cleanings 4 times a year instead of twice a year. And they can also do professional cleanings at that appointment, and you're gonna have a whole team of people to support you. So if you want it, we're here. Thanks so much, and good luck with the journey.